My name is Frank Aviles. I am the Wound Care Clinical Coordinator for Natchitoches Regional Medical Center. I am a physical therapist by trade, but I've specialized in taking care of hard-to-heal wounds, such as venous leg ulcers, lymphedema patients, as well as patients with a lot of drainage that we have a difficult time managing. In my experience, dealing with venous leg ulcers, we come across a lot of challenges. Number one is being able to manage that exudate. We're chasing our tails trying to do that, but also protecting the peri-wound skin and making sure that we can have an adequate number of frequency during the week. For the patient's sake, it's important because if we can't control the drainage, these patients don't want to be out there socially. So it keeps them confined, but also they're having to make do trying to control the drainage. I had an amazing experience using Mepilex Up. So let me share with you how Mepilex Up is different from the other products in the same category. As a clinician for 32 years, using many products out there, I can tell you that I like the fact that Mepilex Up is thinner, has a smaller profile. Under compression, this is important because it helps with patient comfort levels. In addition to that, you'll see dimples on both sides. The dimples helps with absorbing drainage and helps it wick it in an upward direction. Therefore, if it's able to manage the drainage, it will protect the skin and we don't see maceration with the patients that we've used this on. In addition to that, in a way, it looked like it was moving the drainage in an upward direction, minimizing strike-through drainage. So now let me share with you how Mepilex Up have saved costs at our clinics and also how it's helping the patient. We're decreasing the frequency of that patient encounter. So they're coming in once a week, meaning that the dressing can stay on up to 7 days as indicated. We're decreasing the cost per patient encounter, and the patient actually doesn't have the direct and indirect costs that it takes to come to the clinic. So now let me share with you what patients are saying about their experience with Mepilex Up. Number one, they're thrilled that they're not having to be changed as often as before, but they're noticing the drainage is being contained within the dressing. They're stating their pain level has decreased, and they're happy because their peri-wound skin is not as moist, they say, or wet as it used to be with other dressings in that same category. What I would like to share with clinicians that are considering using Mepilex Up is this dressing can help manage these highly exudative wounds by absorbing this drainage. Also, it will protect the skin. We're not seeing maceration. And we can also extend the wearing time on the product, especially under compression. I entered this field for my passion to help individuals with hard-to-heal wounds. Mepilex Up is changing the way I practice. Being able to help our patients, it improves their quality of life and it allows them to spend time with their loved ones. So this is just bringing a full circle with why I do what I do. And thanks to Mepilex Up for allowing me to help patients.